Hello, Sharks. My name is Norman Sartor, and I am presenting to you today the latest in patient satisfaction survey innovation. Patient satisfaction surveys are vital to the existence of any healthcare organization, provider, clinic, etc. It informs stakeholders, provides them with confidence that the organization is moving in the right direction. It provides the organization with the ability to understand their adherence level to industry standard. It's a factor in reimbursements, and it keeps the business growing. The knowledge that satisfaction surveys provide is key to bringing together patient experience and success indicators. Now, many healthcare organizations or providers either don't measure patient satisfaction or they don't do it successfully. They use archaic methods like paper surveys. The result is no patient feedback or minimal, unusable. How does a clinic or an organization know if satisfaction targets are even being met? In these cases in particular, they don't. That's the answer. I have the solution. I offer a web-based solution that is customizable, and it uses both numeric rating scale 1 through 5 and natural language processing. We'll get into that in a little bit. Now, web-based means that you can access the survey on a PC or you can access it on a mobile device. In this particular case, I will show you can access it on your cell phone, and you can complete it on your cell phone. The excellent through poor ratings are the 1 through 5. That is numerical data that's tabulated in the background when these surveys are completed. And then below it, you have categories including doctor, staff, facility, processes, and transportation. You can click on a category and then you can type in the text box what your experience was related to any of those categories. Now, when you type in your experience, you are typing in words, any of which can be interpreted, any of which can be categorized and trended to provide valuable information. For instance, words that utilize sentiment, such as like, great, excellent, poor, bad, are all words that can be brought together and data analyzed. And studies have shown that text input in surveys is actually more valuable if you can extract the data from that information than a simple checkbox where you're asked to say yes or no, or you're asked to say excellent or poor. So in my survey, I've combined both. It gives you the best of both worlds. And in the survey, you find in my product that it's customizable. So an organization is able to go in and manipulate the questions that are being asked and the way in which the data is being interpreted so that they can prepare for whatever it is that they need to as an organization. For instance, Centers for Medicare and Medicaid Services utilize their own survey that they provide to patients who have gone through inpatient stays. And then they use that information to, number one, post publicly so that everybody can see what their experiences were, but also to determine whether or not a hospital is eligible for reimbursement. And if they don't meet certain standards, they don't get reimbursed. Now, if a hospital or healthcare organization is able to utilize a survey that will allow them to proactively understand their ratings ahead of something like that, more formal survey process, wouldn't that be worth the cost? And also, as I'm indicating, the surveys are linked to data analysis mechanisms for reporting purposes. Responsive to both external industry and internal organizational needs and supports, it's a vision of enhanced quality healthcare. My pilot, currently in progress. is with a single healthcare clinic using the company's own IT department, and this process is benefiting the organization, it's benefiting me and my product. It's benefiting the organization because they're able to utilize the information that the surveys provide them to improve their own services, and it's benefiting my product so that we can go through product development and enhancement real time with no cost. Their own IT department's helping us to enhance the development. So through the pilot, we know it works, and we also do not need to ask for any kind of money for development needs at all. And there's already a market out there for patient surveys. One organization currently charges between $1,200 to $4,500 per survey and report. So they issue the surveys to X number of patients, and then they get the responses, they data analyze, and they provide the reports to the organization that requested it. That's a one-time fee. Our survey and accompanying support will offer increased flexibility at a much more reasonable cost. And what is that cost? Sharks? Here is the good part. This is what you want to know. I'm asking for a $150,000 investment, and I'm offering a 50% share. Your investment will pay for one-time commercial license fee for the natural language software. So we're moving from the open source to the commercial license. That's $50,000. One full-time equivalent employee at $50,000 for IT support that we will provide, and then $50,000 for advertising. $150,000 startup first-year investment. Our sales will be per license and total $3,000 annually per license. I project a minimum of 100 licenses sold nationwide in year one, revenue totaling $300,000. Your investment is returned in total year one. I project a 20% increase in per license revenues in year two. Your profit will be $130,000, with expenses projected to be less than year one, and that is reflective of the one-time cost in the commercial license and some adjustment for advertising. Sharks, let your voices be heard.